Okay. So again, the anatomy and physiology is going to be somewhat limited, just enough for you to be able to do your, know what the landmarks are when you're going to do your your echo, and have an appreciation for the anatomy, the structure that you're going to image. So what we're going to do is in the anatomy session, we're going to look at the chest. Of course, we're going to look at the bony structures that make up the chest. We're going to look at the soft tissue that's in the chest cavity. Um, of course, the heart and the related structures. And also, we're going to look at the aorta because we image the aorta when we do echo. We image the aorta, so that's a very important organ for us to look at. So the bony chest, that is the bones that make up the chest wall, includes the manubrium, the body of the sternum, the xiphoid process, the clavicle, the ribs, supraclavicular fossa, and the suprasternal notch. So these are important areas. And when we talk about echo of the heart, um, these are important structures that we constantly mention and relate to. All right. All right. So the bony landmarks. So this is the chest cage, or the chest uh, the bony landmarks of the chest, made up of the ribs, the manubrium, and the body of the sternum and the clavicles. All right. So that's the clavicle, and a very important landmark because we constantly refer to the clavicle when we do echo. The manubrium, which is the uppermost portion of the sternum, the broader portion of the sternum, that's called the manubrium. And then the body of the sternum is the lower portion of the sternum. Then the lowest portion of the sternum is the xiphoid process. So all these landmarks we're gonna refer to quite common when we talk about echo. The ribs are very important because we talk about intercostal spaces, and we talk about the fourth intercostal space, the fifth intercostal space. So you have to know how to count the intercostal space and how you count the intercostal spaces. So the intercostal space, as the costal is the ribs. So the intercostal space is the space between the ribs. So like the first intercostal space is going to be the space between the first rib. So this is the first rib right up here, and the second rib. So this is the first intercostal space, right? Intercostal because it's between the ribs, all right? So this is the first intercostal space between the first rib and the second rib. The second intercostal space is between the second rib and the third rib. Those are bony landmarks that we refer to all the time when we do ultrasound. Again, the first intercostal space between the first and the second rib, second intercostal space between the second and the third rib, and third intercostal space between the third and the fourth rib, and so forth, so on. All right, so it's very important. So this is what we mean by the intercostal space. All right, so that is the space between the first and the second rib. Okay, second intercostal space between the second and the third rib, the third intercostal space between the third and the fourth rib, fourth intercostal space between the fourth and the fifth rib. Okay, so these are important. These are important bony landmarks that we're gonna refer to very frequent. Okay, so these are important bony landmarks and spaces. So when we talk about the supraclavicular fossa and the suprasternal notch, again, important landmarks that we're going to refer to. when we say super mean above. So when we say supraclavicular fossa, so this is the clavicle right here. So it's this space, this area above the clavicle, supraclavicular fossa. Okay, it is the area above the clavicle, and this is the clavicle. So it's your supraclavicular fossa. Again, very important landmark when you're doing ultrasound. And then when we say suprasternal, remember your sternum. So anything above this little area above the sternum is what we call suprasternal notch. Very important landmark when you're doing echo. All right, so those are the bony landmark, and for echo, those are essentially the only things you need to know. Um, you know, the bony structures. Those are the only thing you need to know. So when you come on to the soft tissue now, the soft tissue in the chest, we're going to be doing ultrasound of the heart. So you need to know the anatomy of the heart to some extent. But in the chest, you have the heart, and the heart is somewhat left to center in the chest. Okay, and the heart is flanked by the lungs. You have the left lung on the left side and the right lung on the right side. The left lung has two lobes. It has a upper and a lower, whereas the right lung has three lobes. It has a upper, a middle, and a lower. Okay, and then there are some vascular structures uh, inside the chest as well, and we will discuss those vascular structures when we look at the heart. All right, some important point about the heart. This is the organ that you're gonna image. This is the structure you're gonna take pictures of. So you have to know it. So the heart is essentially a muscular pump. The heart functions as a structure that pumps blood. That is what the heart does. It pumps blood. It's a muscular pump. The inside of the heart is relatively smooth. Okay, it has some valves because it's a pump, and most pumps have valves, and the heart is no different. Again, it is located left to center in the chest. The average weight of the heart is about 250 to 350 grams. Okay, and this is a fairly busy slide, but this is what when you look on the surface of the heart, this is what it looks like. Again, the heart, this is an actual picture of the heart. So this is what the heart looks like, the surface of the heart. The heart doesn't look like a love heart. Those of you guys who have never seen the heart, okay? This is what the heart actually looks like. So on the surface of the heart, you have blood vessels, okay? And these blood vessels, when they close off, you get a heart attack. So this big blood vessel that comes up here and curves around here, this is the aorta. Where the aorta comes out of the heart, you have what we call sinuses or sinus of Valsalvas. And these sinus of Valsalva gives off these blood vessels which line the surface of the heart. On the right side, the right sinus gives off the right coronary artery, which curves on the right side of the heart. Okay, so again, this big blood vessel that comes out here is the aorta. Just where the aorta comes out of the heart, you have sinuses. These are a little outpouching in the aorta. You have the right coronary sinus, which gives the right coronary artery. And then you have the left coronary sinus, which gives the left main coronary artery. The left main coronary artery divides into the left anterior descending coronary artery and the left circumflex coronary artery. There's another sinus we call the non-coronary sinus. So you have the right, left, and the non-coronary sinus. The non-coronary sinus don't give off any coronary blood vessels. So these coronary blood vessels are the blood vessels that line the surface of the heart, okay, and they branch and supply the heart muscle with blood, okay. All living structure in the body needs blood, okay, and the heart is no different. So this is the surface of the heart. Most of the anterior portion of the heart is the right ventricle. Okay, the left ventricle is right over here. Okay, um, so most of the anterior surface is the right ventricle. The left ventricle is right over here. The atria is on top. So coming from this is a vein. This is a very large vein, which takes blood from the lower extremity. Our blood vessels drain from the lower extremity and the abdominal cavity and the chest to some extent. It drains into the inferior vena cava. So this big blood vessel coming up here is the inferior vena cava, and the inferior vena cava drains into the right atrium. This big blood vessel here, which to get blood from the head and neck, is the superior vena cava. And the superior vena cava also takes blood, well, it takes blood from the head and neck and it drains into the right atrium. So the superior and the inferior vena cava get, okay. The superior and inferior vena cava gets blood drains blood into the right atrium. All right. All right. So that's the basic. This blood vessel coming out of the heart. This is the main pulmonary trunk. Okay. The main pulmonary trunk gets blood from the right ventricular outflow tract or from the right ventricle. So this is your main pulmonary trunk, and it divides into a right pulmonary artery and a left pulmonary artery. The veins are, well let's not say. Deoxygenated blood is somewhat, we usually depict that as sort of blue, as opposed to oxygenated blood, which is bright red. So that is why the veins in superior vena cava and inferior vena cava is sort of, we call it blue because it's the blood that is sort of devoid of oxygen. Oxygen is already removed. So, and then this is an artery though, the pulmonary trunk or the main pulmonary artery, but it receives deoxygenated blood. So even though it's a artery, it is only artery that receives deoxygenated blood. So it's depicted as sort of blue. And we have the right and the left. Okay. So this is on the surface of the heart. Okay. You can see these big blood vessels entering and leaving the heart, so to speak. All right. So if you look at the heart from the outside in, the first layer you're gonna see on the outside of the heart is what we call the pericardium. So this is covering of the heart, so to speak. Okay, so the pericardium covers the heart, and there are two layers to the pericardium. The outermost layer is what we call the fibrous pericardium, and the innermost layer uh, consists of so there are two layers, an outer and an inner. The inner is actually two layers. So the outer layer is a fibrous pericardium, and then the inner layer, um, we the inner layer comprised of an outer parietal and an inner visceral. Okay, so it's a somewhat complex structure. So remember that. But it covers the heart. The outermost layer is the fibrous pericardium. And then the inner serous pericardium is divided into a parietal and a visceral. The visceral pericardium actually it's sort of one with the outer surface of the heart, the epicardium. Okay, so when you get fluid formation, it's usually between the visceral pericardium and the parietal pericardium. So when we talk about pericardial effusion, which is a common finding you're doing image or ultrasound of the heart, the fluid usually accumulates between the outer parietal and the inner visceral. So the visceral pericardium is actually on the surface. It's intimately in contact with the outer surface of the heart. The outer surface of the heart we call the epicardium, and so the parietal pericardium is just outside of that. Okay, all right. So that's the pericardium. So when you leave the pericardium, if you're going inwards, further into the heart, so again, the outer covering of the heart is the pericardium. The outermost portion, the fibrous pericardium, is the outermost portion, and just below that you have your parietal and then the visceral. Okay, so if you were to remove the fibrous pericardium, you're left with the parietal and the visceral pericardium. When you get fluid formation, it is usually between the parietal and the visceral pericardium. So fluid here, we call that pericardial fluid. Okay. And then when you move inwards, so this is the pericardium. If you go inwards, this is the outermost portion of the heart wall is called the epicardium, and we're going to look at that. All right. So we talk about the serous pericardium, okay, which divides into the outer parietal pericardium, uh, and then the inner visceral pericardium. Then you get to the epicardium, which is the outermost portion or the outer layer of the heart wall. So the heart wall consists of really three layers. Remember, the pericardium just covers the heart, but when you get to the heart itself, there are three layers. The outermost layer is called the epicardium. Epi is usually outer, and then the myocardium is the middle layer. The myocardium, when you say myo, it means muscle. Cardium means heart. So this is the heart muscle. So the heart muscle is called myocardium. That's the middle layer of the heart wall, which is composed of muscle. So the heart is essentially a muscular pump. And the innermost portion of the heart, okay, that is in contact with the blood, we call that the endocardium. So you have to know the layers of the heart. You have the epicardium, the myocardium, and the endocardium. Endocardium is the innermost layer, which is in contact with blood. So because it's in contact with blood, it has to be smooth. It has to be able to prevent blood from clotting. Okay, so the endocardium is, well, all layers are important, but endocardium is extremely important because it shouldn't allow blood to clot. So if we look at the heart, if we sort of cut the heart into, we do so-called cross-sectional area of the heart. So we get something looking like this. This is the left side of the heart and the right side of the heart. And this is the septum. This is what we call the interventricular septum. So when you have a septum is going to divide things. Okay, so this is your ventricular septum, which divides the heart into a left ventricle and a right ventricle. Okay, there are some important difference between the left ventricle and the right ventricle. And again, when you start doing your ultrasound scanning, these properties are very important. So you're gonna use your knowledge of anatomy to identify the left side of the heart from the right side of the heart. Because again, when you're doing ultrasound of the heart does not come labeled. You have to determine which side is right and which side is left, because sometimes you're going to get what we call congenital anomalies, and you have to decide which is which. So the left side of the heart is usually less trabeculated than the right side. The right ventricle is more trabeculated than the left ventricle. When we say trabeculation, you have these uh, outpouching from the muscular layer. Okay, the left ventricle usually have two papillary muscles. So these humps are what we call papillary muscles. So these humps are papillary muscles. The left ventricle usually have two papillary muscles. And then attached to the papillary muscles, so the papillary muscles are attached to the myocardium. Okay? So the papillary muscle is a muscle and it is attached to the heart muscle. Okay, there's attachment to these papillary muscles we will call coordinate tendinate. So these little fine cords we call coordinate tendinates, they attach themselves to the valve and prevent the valves uh, uh, from prolapsing into the atrium. Okay, so you have your papillary muscles and the coordinate tendinate, which attach to the valve structure, preventing it from prolapsing into the atrium. So the left ventricle has two papillary muscles, whereas the right ventricle have three papillary muscles. Okay? The right ventricle tends to be more trabeculated than the left ventricle. The lowermost portion of the heart, we call the ventricle, and the upper portion is the atrium. So on the right side, you're going to have a right atrium, okay? Then you're going to have a right ventricle. Separating the right atrium from the right ventricle is tricuspid valves. Tricuspid because it has three cusps, and these three cusps are attached via coordinate tendinate to three papillary muscles. So on the right side. On the left side, we have the left atrium on top, okay? And the left atrium is going to drain into the left ventricle. It's going to drain via the mitral valve. The mitral valve has two leaflets. You have an anterior and a posterior leaflet, okay? Mitral valve have two leaflets, and you have two papillary muscles, okay? Again, we had mentioned that the inferior vena cava, which takes blood from, this is venous blood, from the lower extremity and the abdominal trunk, okay, and it drains into the right atrium. Superior vena cava carries blood from the head and neck, and it drains also into the right atrium. So both the inferior vena cava and the superior vena cava drains into the right atrium. All right. As mentioned before, your left atrium is right here. So you're going to get deoxygenated blood. That is why we color this sort of blue. That is blood where you sort of remove most of the oxygen. So when you remove most of the oxygen, well, you remove a significant portion of the oxygen, the blood is sort of, in actual life, the blood look black, all right, but it's depicted as blue. So inferior vena cava, superior vena cava drains into the right atrium. Then the right atrium is gonna, the blood from the right atrium is gonna flow across the tricuspid valve into the right ventricle. Then this deoxygenated blood is gonna leave from the right ventricle through the pulmonary trunk. This is the pulmonary trunk. Still deoxygenated blood is gonna drain through the pulmonary trunk into the right and the left pulmonary artery. It's going to the lungs now. Okay, it's going to the lungs, and the lungs is going to oxygenate the blood. So that is why you breathe. You breathe in oxygen and you let out carbon dioxide. The function of your breathing is to add oxygen to the deoxygenated blood. So the blood leaving the lungs is going to be rich in oxygen, and the blood leaving the lungs is going to flow via pulmonary veins into the left atrium. There are 4 pulmonary veins. You have 2 on the left side and 2 on the right side. Enter into the left atrium. You have an upper and you have lower. Okay? Drains. So now these are the only pulmonary veins that carry oxygenated blood. And this is oxygenated blood, blood coming from the lungs. It's going to drain into the left atrium, and then from the left atrium, it's going to crosses the mitral valve into the left ventricle. Okay, all right. So just going over the anatomy, what happens? Remember, the right atrium receives blood from the inferior vena cava and the superior vena cava. This is deoxygenated blood, blood that is depleted somewhat of oxygen. The tricuspid valve, it's going to separate the right atrium from the right ventricle. It's located between the right atrium and the right ventricle. There are 3 leaflets to the tricuspid valve. You have a septal leaflet, you have an anterior leaflet, and a posterior leaflet. So this description is very important when you're doing echo. You have to know the different leaflets and how to locate them. Okay, so the tricuspid valve, which separates the right atrium from the right ventricle, 3 leaflets. You have a septal, you have an anterior and a posterior leaflet. A very important point, because when you're doing echo, again, the heart does not come labeled. The heart is not labeled. I've never seen a heart that's labeled. So you have to determine which side is left, which side is right. Because patient's going to come to the lab with congenital heart disease, and things are not going to be in the usual position. So very important point is that if you're going to identify the right side, one of the best way to determine which side is right and which side is left, where you have the tricuspid valve is usually lower in the ventricle than the mitral valve. The tricuspid valve is usually located lower in the ventricle than the mitral valve. The mitral valve is usually a little bit higher. So once you see that, you know the lower valve is usually the tricuspid valve, and it identifies the anatomic right ventricle. All right, so we have the coronary sinus. That's a vein that empties into the right atrium. So the coronary sinus is a vein that empties into the right atrium. It runs in the groove between the left atrium and the left ventricle on the posterior surface of the heart. So coronary sinus is a vein. And then the right ventricle receives blood from the right atrium through the tricuspid valve. Blood leaves the right ventricle through the right ventricular flow tract and enters the pulmonary trunk or the pulmonary artery. Okay, so now let's look at the pulmonary circulation. So we know that the right atrium receives blood from the superior vena cava, the inferior vena cava, and the coronary sinus. The blood in the right atrium is gonna enter the right ventricle through the tricuspid valve. Then the blood is gonna leave the right ventricle through the right ventricular flow tract into the main pulmonary trunk. All right. So once we enter in the pulmonary system, that's what we call the pulmonary circulation. Pulmonary mean lungs. All right. So pulmonary circulation. The pulmonary circulation starts with the main pulmonary trunk. Then you have the right and left pulmonary arteries. Then you have your capillaries and your arterioles and capillaries, and then the blood is going to get oxygenated. Then you have your pulmonary veins leaving the lungs. So that system comprises the pulmonary circulation. So again, deoxygenated blood, so that is blood that is somewhat depleted of oxygen. Deoxygenated blood leaves the right ventricle through the pulmonary valves. So when the blood leaves the right ventricle, in order to enter the pulmonary trunk, it has to cross pulmonary valves, and there are three leaflets. The pulmonary valve has three leaflets. Okay, then the blood enters the pulmonary trunk. The pulmonary trunk branches into two pulmonary arteries. You have a left and a right, and the pulmonary arteries deliver deoxygenated blood to the corresponding lungs, that is the left and the right. All right, so just to recap what we've been talking about, inferior vena cava takes deoxygenated blood from the lower extremity and the trunk, that's the abdominal cavity and the chest wall to some extent. The chest to some extent. So inferior vena cava, superior vena cava, they both drain into the right atrium. Coronary sinus also drains into right atrium. So blood is going to leave the right atrium. It's going to crosses the tricuspid valve. It's going to enter the right ventricle. It's depicted as blue because it's somewhat depleted of oxygen. This area, so this is the right ventricle. This area of the right ventricle where the blood is going to leave to enter the pulmonary trunk is called the right ventricular outflow tract. Outflow because blood is leaving out of the ventricle. So this area is the right ventricular outflow tract. Right ventricular outflow because blood is leaving the right ventricle. In order to get to the pulmonary trunk, it has to cross these pulmonary valves, pulmonic valves. There are three leaflets to the pulmonic valves. So this is your pulmonary trunk. Pulmonary trunk divides into a right and a left pulmonary artery, which goes to the corresponding lungs. Okay, and you can see when it enters the lungs, it is blue, but once it's oxygenated, once oxygen is added to the blood, it becomes bright red, and then it leaves the lungs via pulmonary veins. Okay, you have two from the right side, two from the left side. It enters the left atrium. Left atrium. Okay, so now it's bright red. Blood is going to flow from the left atrium. Blood is going to flow from the left atrium across the mitral valve into the left ventricle. Okay, still bright red, rich. Then blood is going to leave from the left ventricle into the aorta. Blood is going to leave from the left ventricle into the aorta. The area where the blood is going to leave from the left ventricle is called the left ventricular outflow tract because that is where the blood is going to leave from. So this is all the left ventricle right here, but this little area just before you get to the aortic valve is called the left ventricular outflow tract because the blood is going to leave from the left ventricle from this area. When it leaves the left ventricular outflow tract, it has to cross the aortic valve. There are three leaflets. The aortic valve is located right here. Three leaflets. Then when the blood flows across the aortic valves, it enters the ascending aorta. The lowermost portion of the aorta we call the aortic root, and then when the aorta goes up, we call this the ascending aorta because it ascends. And then when it curves, we call this the aortic arch. And then when it comes down, we call this the descending aorta. All right. So those terminology is very important. We use them in echo, so you have to get accustomed to those terms. So the left ventricular flow tract, the uh, aortic valve, three leaflets. Okay, the three leaflets. Remember, we talk about the coronary sinuses, and the leaflets correspond to coronary sinus. So you're gonna have a right coronary, a right. So the aortic leaflet. So you're gonna have a right, you're gonna have a left, and a non-coronary leaflet, just like you have the sinuses that we spoke about. All right. So your aortic root is right down here. When it goes up, it's the ascending aorta. And when it curves, this is the aortic arch. This is your descending aorta. Okay? All right. So the pulmonary veins carries oxygenated blood from the lungs to the left atrium. There are four pulmonary veins, two on the right and two on the left. Okay. So if we're just looking at the left atrium, so pulmonary veins, and the reason why these are the only veins that carry oxygenated blood, so that's why it's pink. It's depicted as pink. So two on the right and two on the left. You have an upper and a lower. So these four pulmonary veins drain into the left atrium. Okay. Then you have the mitral, again, the mitral valve of two leaflets. You have an anterior leaflet and a posterior leaflet. Okay, so again, on the surface of the valve, you have these coordinate tendonae, these cord-like structures, which attach to the papillary muscles. So in the left ventricle, you have two papillary muscles. This is the anterior lateral papillary muscle, anterior lateral papillary muscle. This is your posterior medial papillary muscle. Important to you have to know the names, because if there's a problem with one of the papillary muscle when you're doing your ultrasound, you have to identify it correctly. So this is the anterior lateral papillary muscle, posterior medial papillary muscle. These papillary muscles anchor down into the myocardium. Okay, it prevents eversion of the valves. Uh, so the papillary muscles are connected to the valve via coordinate tendonae. This is your ventricular septum. On the right side, you have three papillary muscles, and you see coordinate tendonae, tricuspid valve has three leaflets. All right, again, so if you look at the pulmonary circuit, so you can divide them into, you know, so if you're just looking at it from the deoxygenated blood and the oxygenated blood, superior vena cava, you're going to get deoxygenated blood from the head and neck. Inferior vena cava from the lower extremity and the abdominal trunk. Blood is going to drain into the right atrium from the superior vena cava, inferior vena cava. Then it's going to cross the tricuspid valve into the right ventricle. It's going to leave the right ventricle through the right ventricular flow tract, pulmonary valve into the main pulmonary trunk. We have the pulmonary arteries. They're going to go to the lungs. The blood is going to be oxygenated now. Then the oxygenated blood is going to drain into the left atrium via pulmonary veins. Okay, two on the right, two on the left. You have upper and lower. So on the left side, you see it's pink because it's now oxygenated blood. Drains into the left atrium, crosses the mitral valve, left ventricle, leaves the left ventricular outflow tract into the pulmonary, crosses the pulmonary valves into the ascending aorta, the aortic arch, and the descending aorta. There are branches that comes off the aortic arch, and you have to know that. If you're doing echo, you have to know the branches that comes off uh, the aortic arch, and we'll talk about them later. So just to go over what we just showed you guys on the left side, the left atrium receives oxygenated blood from the pulmonary veins. The mitral valve, which separates the left atrium from the left ventricle. So the mitral valve is located between the left atrium and the left ventricle. Okay. The mitral valve has two leaflets. Okay. The mitral valve has two leaflets. You have a anterior and a posterior leaflet. Okay, they're anchored into the ventricle via the papillary muscles. Okay, the mitral valve is usually higher in the ventricle than the tricuspid valve on the right side. Very important method to distinguish the left side of the heart from the right side of the heart. The AV valve, which is lowermost in the ventricle, is going to identify the tricuspid valve and the right ventricle. Now, papillary muscles, they're located in the left ventricle. You have what we call the anterior lateral and the posterior medial. So in the left ventricle, there are two, because the mitral valve usually have two leaflets. So you have the anterior lateral papillary muscles and the posterior medial papillary muscles. Okay, they attach to the mitral valve via the caudinae tendineae, and they contract to prevent eversion or prolapse of the valve. So the left ventricle receives oxygenated blood from the left atrium through the mitral valve, and then blood is going to leave the left ventricle through the left ventricular flow tract into the aorta. It has to cross the aortic valve. The aortic valve has three leaflets or three cusps, all right? And it looks somewhat like that. So this is your left ventricular outflow tract right here, and this is your aortic valve apparatus right there. There are three leaflets, okay? If you look at just where the aorta comes out of the left ventricle, they're sort of outpouching, and we call those outpouching the sinus of Valsalva. So there are three little outpouching which gives rise to the valves, and we call those sinus of Valsalva. That is where the blood vessel comes off to traverse the surface of the heart. Okay, so you'd have a right, you'd have a left, and a non-coronary. Reason why we say the right sinus gives off the right coronary, the left sinus gives off the left coronary, and then this is a non-coronary because it doesn't give off any coronary artery. So that's why it's called non-coronary. So in actuality, it looks like this. You have a left. So these are sinuses, and sinuses are a little outpouching. Okay, so these are the leaflets, and then they sort of have these little outpouching. We call we call them cusp as well. So left, right, and non-coronary cusp. So this cusp, so the left coronary system comes off right here. Left coronary artery comes off from right there. The right coronary artery comes off right there, but this one don't have any. That's why I call it non-coronary. Okay. So the aorta now, the aorta is the largest blood vessel in the body. Okay, so a large blood vessel which carries oxygenated blood from the left ventricle. So the blood is going to leave the left ventricle via the left ventricular flow tract, okay, into the aorta. But first it has to cross the aortic valve. And then it's going to supply blood to the head and neck the thoracic trunk, and the limbs. So basically, it supplies blood all over the body. Because that is the aorta carries oxygenated blood that all structure in the body needs. The aorta divides, as we said before, into an ascending aorta where it comes up. Then you have the aortic arch where it arches over, and then you have a descending aorta where it comes down. So the aorta, if you were to separate the aorta from the heart, so this will be the lowermost portion. The aortic valve will be right inside there. Distal outpouching, this is what we call the sinus of Valsalva. Distal outpouching. And you can see the coronary blood vessel comes out from the sinuses. So the right would come from the right coronary sinus, the left would come from the left coronary sinus. So these little outpouching in the lowermost portion of the aorta is called the sinuses. Okay, this is what the aortic root is right here, aortic root. Then when the aorta comes up, it's the ascending aorta. Comes up, ascending aorta. Then when it arches over, this is the aortic arch, and then descending aorta is right down there. All right. So you have to know the branches that comes off the aortic arch. Okay. This first branch is what we call the innominate or the brachiocephalic branch. And this innominate or brachiocephalic gives rise to the right subclavian artery, and this is the right common carotid artery. Innominate or brachiocephalic, right subclavian, right common carotid. This is your left common carotid, and this is your left subclavian. You have to know the branches that comes off the aortic arch. We commonly refer to them when we're doing echoes, so you have to know that. All right. So if you look at the atrium, so the uppermost portion of the heart is, we call that the atrium, and the right and left atrium is separated by atrial septum. Okay, so the atrial septum separates the right and the left atria. Okay, it's a relatively thin structure, and there's an what we call the foramen ovale, which allows blood flow to enter the left atrium in fetal life. So the foramen ovale in fetal life, in the developing baby, it's actually um, a communication between the right and the left atrium, and it allows blood to flow from the right atrium into the oxygenated blood now. Oxygenated blood to flow from the right atrium into the left atrium. Remember that the fetus is not breathing, so the fetus is going to get oxygenated blood from the maternal placenta. Okay, so oxygenated blood is going to travel from the right atrium to the left atrium via the foramen ovale. This closes when the baby is born. All right, so that's the atrial septum, separates the right atrium from the left atrium. Then we have the ventricular septum, which is a thick muscular structure. Well, it's a thick structure which separates the right and the left ventricle. Okay, you have the muscular septum is thick. Okay, and then you have the membranous septum, which is thin and fibrous. So it looks somewhat like this. So this is the atrial septum up top. This is the right atrium, left atrium. The foramen ovale is this defect. And in fetal life, you have oxygenated blood going from right to left. So that's the atrial septum. The ventricular septum now is this thick. So the thick portion of the ventricular septum here is the muscular septum, and then the membranous septum is this thin, fibrous portion up top. So the ventricular septum separates the left ventricle from the right ventricle. See a muscular, thick muscular structure and the thin fibrous structure. I am not going to do physiology. I'm going to give you time to go over the anatomy, fully comprehend the anatomy.